the House has narrowly passed President Trump's sweeping tax bill with a 215 to 214 vote. And by the way, there were two Republicans who actually missed the vote altogether, which is one of the biggest legislations to come across within the past 8 years or so. But nonetheless, they still got this passed. And the legislation introduces significant tax cuts favoring the wealthiest Americans by implementing stringent work requirements for Medicaid recipients. And critics argue that the bill disproportionately benefits the rich and undermines essential social programs. So as we get into this bill, I want you guys to understand some of the hallmarks, some of the key components within this bill. But let me have you guys to listen in on how the bill got passed through the House.
Present. Mr. Norman, present. Mr. McClintock. Mr. McClintock, aye. Mr. Grothman.
The ayes have it. The motion's agreed to. The One Big Beautiful Bill Act is ordered, reported favorably to the House of Representatives with a favorable recommendation.
All right. Well, he said he was going to get it done, and he got it done. Of course, some people would like to believe that this was very difficult, but it was not. This was not difficult because the Republicans control the presidency, the executive level. They control the House, and they also control the Senate. So again, some people like to believe this was very difficult to get passed. Well, I believe something very differently. I believe that it was easy. This had to have enough people on board that already sides with him that actually help him to get elected and selected in order to pass this bill. So let's talk about some of the key components within this bill, the work requirements for able-bodied adults, because for the first time ever, Medicaid eligibility will be conditioned on community engagement. Starting as early as December 31st of 2026, adults without disabilities who aren't pregnant or primary caregivers must clock at least 80 hours a month of work or training or volunteer service or risk losing their coverage. Now, hardliners drooled over the projected savings, nearly $280 billion on the original timeline, but the real cost is the human. An estimated 7 million people could be cut off from care. Now, currently, Medicaid expansion enrollees pay little to nothing out of pocket. Under this bill, anyone over 100% of the federal poverty line will face co-pays of $0 to $35 per service. Now, this is capped at 5% of the family income. That means a single mother making just above poverty could be hit with hundreds in medical bills, a sure way to scare people off preventive care. Now, some of the relentless eligibility redeterminations and verification requirements, you can actually say goodbye to those annual checks because states must now verify your address regularly and feed them into a new HHS data platform by 2029, check death records quarterly, and instantly boot anyone flagged. Now, granted, I do not agree with this part of the big, beautiful bill, but within these constraints and these requirements and some of these restrictions, I do agree with verifying the address. I do agree with checking death records. And third, they have to reevaluate expansion enrollees every 6 months instead of once a year. Now, that's going to mean more paperwork, more red tape, and more people losing coverage purely because they missed the form. That's why I stated I only agree with a certain part of this because, again, through the likes of Elon Musk with Deutsche, his very short tenure there, he did prove that we have people who are 110 and 15, 120. He even proved that there was someone on the books that checks were still being sent 360 years of age. Now, we know no one that we know of who are registered in any place in the world is that old. So again, it's not as though I'm siding with Elon Musk or going against Elon Musk. There's some truth that he did reveal in a lot of his audits and investigation with the Department of Deutsche. Now, they're also slashing retroactive coverage because today's Medicaid covers you for 3 months of past medical bills once you are enrolled. The new bill will cut back to 1 month, leaving low-income people, especially pregnant women, on the hook for ER visits they thought were covered. So it's going to be a big surprise. They also targeted ban on certain services like gender-affirming care for minors. That's gone. Abortion-related nonprofits. There is no federal Medicaid dollars. Illegal immigrants access. Of course, I agree with this one. States can choose to freeze them out if they don't, they lose 10% of their federal match rate. Here's going to be the kicker with this, folks. If a lot of these states do not abide by this big, beautiful bill, and they're willing to lose 10% of that support and that aid, he's going to increase it to 25. He's going to increase it to 50%. So it behooves them to abide by this big, beautiful bill when it comes to illegal immigrants. As I stated, I only agree with certain parts of this because to a certain degree, you would like to believe that the Medicaid that the government is providing, that is supposed to help to save lives and suffice life, sustain life. This isn't about saving lives. It's about scoring cultural war points at the expense of the public health. What about pharmacy benefit manager? Those PBMs, that is going to be a clapdown. Spread pricing, it's going to start to skim the PBMs and take off the top of prescription costs. That's getting banned because in theory, they should rein in drug costs because in reality, it's a window dressing on a package that slashes coverage everywhere. So I know a lot of people have their take on this, but this package is a masterpiece of political theater. It looks like we're doing something about deficit spending, but in practice, it's punishing the sick, the poor, and the people who simply can't afford these new Medicaid constraints. And instead of fixing fraud or waste, it creates mountains of bureaucracy guaranteed to kick people off their roles. If enacted, expect a public health nightmare and skyrocketing uncompensated care costs at hospitals and clinics. And unfortunately, and I'm saying this with a very pound of salt, this is what the majority of the American people who voted for. These are some of the tenets that lead back and anchor in to some of the audit and investigation work of DOGE. Some of the elements of this bill I do agree with, but if the poor, the marginalized, the disenfranchised, if they're going to be harmed the most, is this better for America or is this better for the wealthy?